All right, next patient here. Let me, whoa, wow. Hey, it's Dr. John here. So I had this very unique patient come into my office. And the story is that she had a contusion injury where an object hit her foot and it all of a sudden swelled up like a balloon. I mean, this is huge. So obviously I want to see what's inside and what kind of, if she's got fluid or what she's got going on here. So I'm giving her a little anesthetic. I do have a little epinephrine in there just to make sure that it doesn't bleed too much. So while I'm doing this, I'm going to be hopefully able to determine what is going on with this patient. The backstory is this. She had amniotic band syndrome, and as a child had multiple surgeries. She did already have a deformity and adhesions to her foot and her ankle. So this was not necessarily something that we had a normal foot and all of a sudden became like this. So here I am aspirating, and of course we see this clear yellowish fluid coming out. This is serous fluid, which I'm much more happy that it's serous fluid as opposed to pure pus. If it was pustulant drainage, obviously she has a huge infection, and this is somebody I would have to actually take to surgery. So I decided to stick an 18 gauge in there and drain it. And funny thing is, when I'm taking off the syringe, the pressure from all of that fluid just is causing this to just drip out. And I thought, well, let's go ahead and just let it start to drip a little bit and see, how much fluid we can get. So a little basin underneath to capture all the fluid. And this thing is just going to town. I'm going to speed it up here because it took a while for this all to kind of just drain out a little bit, but it obviously wasn't draining enough as quickly as I wanted. So we're going to go ahead and drain it some more. So I get another syringe and basically withdraw some more of the serous fluid. Patient doesn't feel anything. She's got anesthetic in her there. Although the patient did relate that she really didn't feel too much. In fact, this whole condition really was not very painful to her, as one would think. It just was very difficult to fit into any type of shoe. So she was essentially walking around with crutches, putting no weight onto that foot. And as you can see, I am just withdrawing multiple syringes worth of a 10 cc syringe there. And it just keeps coming. I'm actually shocked during this point, and I'm thinking, is this ever going to end? So as you can see, as I'm draining it, you can kind of see the foot almost deflate, just like a balloon. Now she does have a little bit of a wound on top of that foot, as you can see where that dark red area is. And that is a spot where she did get hit, and it actually caused a little bit of a superficial wound, which we'll have to attend to. So now I took out most of the serous drainage here, but there's still an aspect around just right behind her toes that I wanted to make sure that there was no other pocket of fluid. So I redirect the 18 gauge needle and basically try to see if I can catch another pocket. And there was nothing there. And this is essentially where she had a lot of adhesions and scar tissue from just her prior history. So not a whole lot in that area there. Now again, many of you are asking, well, how in the world did this even begin or start? Seromas can happen most commonly after like a plastic surgery abdominal surgery, breast surgery, things like that. In the foot, we really don't see it as often. This is not a common occurrence for the foot to show up like this. But in her case, because of her amniotic band syndrome and this adhesions, essentially that traumatic contusion she had caused a buildup of serous fluid. So once we've drained it, a light bandage is applied, but I want to put a compressive bandage. So this is essentially Coflex and self-adhesive bandaging, which is great because it starts to kind of get tighter along that area of the foot as it is applied. And she'll have this on for about a week, and we'll see her back. And more than likely, she may have some occurrence of some seroma fluid, which we might have to drain some more. But once we kind of at least take care of this main part, we can get her back to normal as best as possible. Well, hope you all enjoyed. Take care. We'll see you next time with the next video.